And more recently, I've, through my nursing degree and looking around in the health system around women's health, became aware that health is actually a real big barrier to women in the workforce, to us applying for promotions, to many of us stepping up into those career positions that can be more demanding. But really, that's tragic because menopause is a normal life phase that everyone born with ovaries will go through, whether you identify as a woman or not. And many of us don't know how to have a good time through it. So I myself did not know anything about peri in my late 30s when I started experiencing some symptoms. And that was really shocking to me because my dad was an obstetrician and my mum was a midwife. So we talked way too much about women's health in my household. I knew way too much about having babies when I had my two children. I was a bit petrified, to be honest, because I'd heard all the gory details around women's health. But I didn't know anything about perimenopause. And in midlife, when I decided to go back to where I was always interested in working, which was in health, and retrained as a registered nurse, much to my dad's dismay, because he was the one that said, do not go into health, go and become an accountant and have a nice life. I, in midlife, after having kids, went, no, I actually really want to go back to where I wanted to start my career, which was in health. So I did a Masters of Nursing as a mature age student. I also worked for St John Ambulance during COVID, so that's a topic for another day. But what I discovered was that women's health doesn't really take up much of the curriculum around nursing, and particularly now we've found out through a Senate inquiry last year that most GPs and doctors don't have good training around menopause either. So where that leaves us is, as individuals experiencing this normal life phase, we don't know how to stay well through it. It means that our workplaces are not supportive of some of the things that we might need. And we have this real stigma and taboo associated with menopause. For me, in my late 30s, to be honest, I did go to many GPs and no one said perimenopause or menopause to me. And I just came off a call this morning with the Department of Health, and we were talking about whether GPs and nurses need help to raise whether menopause could be an issue for someone, because they might get not a great response from that person if you start saying menopause to them as a reality. And again, that just highlights we've got this huge stigma around this time of life, which we really need to break down, because I think women in midlife and going through menopause are powerful. I know that so many of us have a refocusing like I did. I looked back at where I was in my career and went, I don't think being an accountant and doing this work is where my passion lies. And I got to the point where I had enough confidence to go back and do something that I really felt passionate about. And so there's so much power that can be harnessed in this time of life when we're reflecting on where we're at, on whether our life aligns with our values and where we want to be. So there's so much that can be gained from celebrating this amazing time of life. So that's a bit of a background as to why I'm here and where I've sort of come to in this topic. Menopause Friendly Australia is an organisation that I founded here as a result of my investigations into finding out who's talking about menopause globally and where we might be able to find some learnings to share from across the globe. I found actually that the UK have been talking about menopause for many years, and it's almost normalised there now to talk about it. So I went to the UK. I met with a number of people who were raising awareness, particularly in the workplace. And I formed a partnership with the Menopause Friendly UK. And that means that we can now provide a methodology to workplaces in opening the conversation, providing awareness, and looking at their working environment to make sure that they are being inclusive of the needs of people in midlife. But also we know that it really works because we've been doing it in the UK for almost a decade, and they've been able to really shift the dial on women in work. So Menopause Friendly Australia, I launched that 2 years ago, and we now have over 40 members who are corporate members, so workplaces, right through from small organisations and not-for-profits like Carers WA, I remember, The Parliament of WA were the very first member, so the politicians in our Parliament House have access to our support and resources, as do the people in the building. And right through to bigger corporates like Commonwealth Bank or BHP, we support small and medium and large organisations to really genuinely shift the dial on menopause in the workplace. And in doing that, it's really important to us to provide evidence-based information. I know there's a few people in the chat who said they're here to learn about menopause themselves. So many of us have, are struggling to find information, and a lot of people are resorting to Facebook and non-evidence-based sources of information, which can sometimes be quite confusing. So it's really a big passion of mine as a practitioner is making sure that when we're providing information to people in the workplace, that it's really evidence-based, and that people can then rely on that information to have a better time through menopause. So that's a bit about me, a bit about Menopause Friendly. So I thought what we'd do is, given that we have some people on here that are interested in learning more about menopause, is I'll talk through a little bit about perimenopause, menopause, some of the things that you might have heard about it, maybe bust some of the myths that you may have heard as well. And then I'm going to pass on to Linny, who's going to talk about some really, really important aspects in terms of the cultural aspects of menopause as well, which is really something that we need to really lean into as well. And hopefully we'll have some time at the end. I'd really love to hear from you all about your menopause experiences and any challenges you face, and in your workplace particularly, if there's anything that that you wanted to ask, so that we can have a good chat, because we've got a really nice intimate group today, and I can see some friends on the call too, which is really nice to see. So perimenopause and menopause. So menopause technically is a one-day event. That is something that people are often quite shocked by, because anyone in it, I'm sure you'll agree, it's not a one-day event. It goes on for many years. So like technically it means the end of periods, the ceasing of menstruation, and 12 months from your last period, that day is your menopause day. So when you haven't bled for 12 months, that's your day. Some people like to have a party. Katrina Stratton, who's one of the members that's really championed this, she had a menopause party. She didn't invite me. I was really annoyed, but she did have a menopause party. It was a very small, intimate affair. So you mark that date on the calendar, and that's your menopause day. But the time leading up to that, when your hormones are starting to change and fluctuate, but you still might be having a period, that time is called perimenopause. So peri means around. So it's about a decade for some women that they might be experiencing hormone changes. For some women, it might be 2 or 3 years. And again, you hear me talk a little bit about how it's nuanced, and everyone's experiences are different, and everyone on this call will have a different experience of menopause. So perimenopause is really when we're talking about symptoms, and when people complain a bit about menopause and all the changes and the hot flushes, we're really talking about perimenopause. And that time's very confusing, because some of the symptoms are really, they're not, you can't really put your finger on them. You might just feel that you're more anxious or stressed. You might see that you can't sleep as well as you used to. You might be waking up at night where you didn't used to. You might have muscle and joint pains, which are popping up for you. You might actually find that you're having more injuries when you're doing some of your gym workouts and things. Mood changes. So for me, the tearfulness was so difficult. I was crying pretty much every day when I came home from work, having a good old cry just for no particular reason. And really for me, it was also the anger. I just could not control the anger that I was experiencing, particularly taking that out on my kids. So not being able to control my emotions as well as I used to, almost felt like a really severe PMS, but continually. And then it would be okay for a while, and then it would come back again. So really challenging often for many women to identify if they're in perimenopause or not. Often for many of us, we might be on long-acting contraceptives, and it's great. I saw someone on the call who's typed in that they're working in the space around women's health as well, and I think it was early prevention detection of HPV and cervical screening, which is great. I'd love to hear from you after. So a lot of women are using IUDs, or we're using contraceptives, or we might have had a hysterectomy, so we actually don't know whether we're in peri or whether we're through peri, because we might be using these contraceptives which prevent us from having a menstrual cycle. And it is really important that we know how and when we're going through menopause, so that if we're experiencing symptoms, that we can get support for them, but also so that we can look after our longer term health, because there are some increased health risks that are associated with going through menopause, particularly early. So before 40 is called premature ovarian insufficiency. Anyone on the call who's had a geriatric pregnancy will probably also hate these terms that we get in the medical world around an insufficiency or a geriatric pregnancy, but that's the technical term, is going through menopause before 40. If you go through menopause before 45, that's called early menopause. And those, if you do experience that, there are an increased, that does increase your risk of things such as cardiovascular disease, osteoporosis, diabetes and dementia. So it's really important that we know when we go through menopause and setting ourselves up for longer term health in our post-menopause years as well. So for us, it's really important to give people information so that if you are experiencing symptoms or if you're curious about whether you're in peri, you know where to go, how to find out if you're in it or not. So one of the best things we say is to start tracking how you're feeling. Your symptoms might be urinary symptoms, mood symptoms, changes in your period, headaches, you might have joint and muscle pain, mood changes. So there's some really great ways you can track your symptoms through apps. There's lots of resources available that are free online as well. And when you go to a doctor, if you're over 45, the way they'll diagnose menopause is through something called the Green's Climacteric Score. So it's a validated tool for the diagnosis of perimenopause. It's green with an E. You can Google it, download it, and have a look at what those symptoms are. You can fill that score sheet in yourself, and that will give you an indicator as to whether you might be in perimenopause or not. So it's good to have that piece of information. If and when you want to go to your doctor, you could have already tracked your symptoms, go along and say, this is what I'm experiencing. You've got that full map, and you can then have a really good conversation about what the main concerns are and where you might be needing some support. For me, I didn't do that. I went to the GP. I had a good old cry. Love to have a good old cry. When you go into the GP, everything's terrible. You have a good old cry and they say, sounds like you're really stressed and anxious and you need to go on some antidepressants and here's a script. And that's often women's experience because we're so overwhelmed. We just want some help. We finally get a GP appointment and we go in and we don't actually do ourselves any service by not actually having the conversation that we need to have, which is really comprehensive about all of the things that are going on for us and then enabling that really great supportive conversation. So again, my experience was that I had lots of more what we call psychological symptoms of menopause, but I did then get heart palpitations. And for me as a registered nurse, it wasn't too scary because I knew it wasn't a dangerous arrhythmia I was experiencing, but it was still pretty confronting. You know, I was having these really thudding heartbeats and skipped heartbeats and really racing heart. And that for me was almost like the validation. And it was so nice to have that validation. Obviously, heart palpitations aren't ideal, but it was something that I could measure. I went and got a heart monitor put on. They went, oh yeah, you're having, you know, these quite regular, it was almost every minute, heart palpitations. And there was no underlying reason why. I had all of the relevant tests to make sure it wasn't anything serious. I was told to take some magnesium and I'll just get used to it. So again, you know, that heart palpitation for me was like, oh, something else is going on here. And that then led to me being able to find information about what was going on for me and being able to put all of this information together to then get the help and support that I needed to feel better. So again, I don't want anyone to have to go through that type of process because it can take significant time. It's really scary having to go and have all these appointments. But it is really important that we do go and see a doctor because we don't want to assume that our symptoms are menopause when they're not. And we do hear stories of some women putting off appointments thinking, oh, it's just perimenopause because my bleeding's, you know, all over the place, but actually it's something more underlying. So again, we really want to encourage people, if you're experiencing anything, any changes that you're concerned about or any symptoms that are impacting your daily life, find a really good practitioner, go and speak to them and get the help that you need to feel better now and to also set yourself up for that long-term health in post-menopause. So that's kind of the symptoms, a bit about my journey. And then we mentioned that 1 day event of menopause. So that's on average between 45 and 55 for most women. And then after that day, because we've marked that on the calendar, unfortunately doesn't mean our symptoms just disappear overnight. Our bodies are constantly changing, our hormones are changing, and the post-menopause, we can continue to have symptoms for many years. So it can be a 15-year transition for many women, and through that transition, our symptoms can really change as well. I mentioned 45 to 55 is the average, and we mentioned before peri can be 10 years earlier. So it's pretty normal to start getting symptoms in your late 30s. And that's again something that many women don't realise, that how soon those changes in their hormones might start impacting them as well. So I'm going to wrap up my kind of presentation a little bit earlier because I really want to get to hearing from you and I really want to hear what Linny has to say. But I haven't gone through things like what treatments available for things like HRT, the reason why there's a lot of fear around HRT, which we now have new research, amazing research on, and some new treatments for menopause, but also lifestyle changes and things like that. Those are all of the pieces of the puzzle that there's some practitioners on here I know that help people with and that we also provide information on as well. But I really just wanted to highlight what menopause is, how it impacts people, some of the work we're doing. And I really look forward to hearing from some of you after we hear from Linny. So I'm going to pass over to Linny to talk more about the amazing work that you do there.
Great, thank you. And thanks, Grace, for that intro as well, because that's a really good way to set the scene for what we're going to talk about. Alicia, I'm happy to just talk, given like Grace did such an amazing job. So I'm happy to just go off the
Up
cuff.
to you. You can definitely show some photos.
No, all good. So I'm here to talk about the work of the Water Well Project. And I guess just to get an understanding of why the Water Well exists and what it is. So I am a pediatric infectious diseases physician by day, and I volunteer and founded the Water Well Project 14 years ago as a first-year doctor. Essentially, the reason why it came about is that my parents were Vietnamese refugees to Australia in the 1970s. And I guess growing up as the daughter of refugees, I experienced, I had that experience of being the child interpreter in their sort of doctor's appointments at the age of 6. So I would sit there with a Vietnamese English dictionary and translate for them. And so, when we were growing up, my sisters and I, who were born in Australia, learnt that, they essentially instilled in us that we had to get a good education because they had missed out as refugees, and that it was really important for us to give back to society. And so I ended up, initially doing pharmacy. So I was a pharmacist and then went back and did postgraduate medicine. And my sisters both work for WHO. So we've all ended up in that sort of helping profession, as they sort of described. And I guess what I saw, when I went into medicine was at one stage I was working in a metropolitan hospital in the outer sort of suburbs of Melbourne. And I was seeing a lot of patients who were very similar to my parents. They had, non-English speaking backgrounds, they had very poor health literacy, and they were presenting in emergency with very preventable diseases. So complications of, blood pressure, heart disease, things that just didn't need to be in hospital in the first place. And so that was kind of some of the origins of why the Water Well Project started. We've now, as I said, been going for 14 years. I think the reason why this work is really important, and Grace alluded to some of the stuff around, misinformation, stigma, and I guess the importance of people receiving the right information to be able to make decisions around their health. So we know that in these populations from refugee, migrant, and asylum seeker background, that they have poor levels of health literacy. So, and that can be as a result of, lower command of the English language, different experiences of healthcare, and we think about it in a women's health setting. And if you think about some of the countries that these individuals come from, preventative health and antenatal care is just a completely foreign concept. It's a very Western medicine. To think that we present at several times during our pregnancy, have that awful sugar test, have blood tests, and are subjected to various different scans is a completely foreign concept to many of the individuals and communities that we come across. a lot of them actually laugh at us and say, why would we do that? We would just, grow our baby at home, and then we would deliver at home, and we wouldn't even need to see a doctor. So when we think about sort of women's health in that sort of light, it kind of, for us as, Western doctors and practitioners, it's just a very different way of thinking about things. So in terms of some of the sessions that we have delivered as a result of 100 women, so we proposed that we would do 50 sessions over 2 years. I think we're now over, 35 sessions already. And the sessions we've delivered have been in topics like women's health, reproductive health, pregnancy, postnatal care, child health and development, and healthy relationships as well, which I'm sure all of you are very aware is a very topical topic at the moment. To date, in terms of our sessions, what we've learned from these women in terms of the sort of cultural barriers is that a lot of them firstly would describe the fact that it was taboo to talk about women's topics at all in many of these communities. And so when we are when we're delivering health education sessions, one, we're going into the spaces of the community. So we're sitting in English as additional language classes, mothers groups, like children's sessions outside of the maternal child health nurse clinics, various different community groups where they are already meeting. And so these are women who know each other, and they, in that safe space are able to talk about some of the shame, discomfort, and cultural taboos around talking about women's health issues, which, specifically we found this in Burmese communities and some of the Pacific Islander groups as well. So just to have that sensitive and culturally safe space has been a really big game changer for them. And so with our volunteers, so we have over 350 volunteers across Victoria, New South Wales and Tasmania. We're entering the community space and we are literally sitting down and having a conversation with these individuals about health topics. And I guess one of the beauty of our sessions is that we let the community lead the discussion. So we might go in there and say, we're going to talk about menopause or we're going to talk about reproductive health. And we essentially follow the narrative of where they want to go. So some of them will share stories, which is really amazing. Others will talk about their experiences, and there's a lot of Q&A going on. The other thing that they mention in these sessions is that they have difficulty in accessing accurate information, especially information in their own languages, but also even when it is translated to another language, they find that the lingo is quite difficult in terms of being able to translate concepts. And we've seen this across the board in medicine. For example, we had a family present to one of the hospitals that I work at. Again, it was a Burmese family, and we had to explain to them that their child needed to start it on chemotherapy. And the first issue that we came across was that there was no word for cancer in the Burmese language. And so we somehow had to explain what cancer was and then describe how we were going to inject poisons deliberately into their child to cure this cancer, which they didn't understand. So you can imagine with, some of the women's health issues when we talk about cervical cancer screening or breast screening, again, like that's a really difficult concept for some of these women and communities. The other thing that we found is just that, I guess the power of that storytelling and dialogue, and for them to be able to share stories has often kind of lifted communities in a way that we, wouldn't normally expect, because we're going in there to share information, and so there's this almost sort of powerful residual effect that's happening in communities, which is really amazing as well. We talked about preventative health screening. So again, a lot of these communities just sort of just can't believe that we have these resources available to do cervical cancer screening or breast screening or all of those things, because again, it's not something that they have had access to in their home countries. And I think Melissa raised HPV. So again, when we have this conversation with communities, HPV, firstly explaining the virus, explaining how it can cause cancer, explaining that there's a vaccine that might prevent it, and then having to talk around some of the stigmas and misconceptions around fertility and how it might promote promiscuity, for example. These are all very very sort of nuanced and difficult conversations depending on sort of how they're framed. I guess just to end, some of the really lovely stories that we've heard about have been around the fact that after coming to some of our sessions, we've had emails to say that, you know, women felt really comfortable sharing information, and then they went and had, you know, their breast lumps checked, or, you know, went and had mammograms and found breast lumps, and that they decided that one of them said that it was really funny we were talking about menopause because they didn't understand what their symptoms were. And now that they understood, they wanted all the men in the community to have the same session to explain to them what was going on, which we thought was quite lovely in a way. So I guess, yeah, to wrap up, really, you know, we've been really grateful for the support of 100 Women, and I think, you know, it's all about making sure that people have accessible information that is accurate and timely, and, you know, to try and dilute the noise of social media and the misinformation. But yeah, really what we're about is making sure that people have equitable health outcomes regardless of where they come from. And so we're really grateful. But yeah, I'll throw back to you, Alicia. Thank you.
Linny, you're just amazing. Gosh, vision. And then starting, you know, the Waterwell project as well, just on the side, you know, is just incredible. And being able to share that knowledge, as you say, which can be just so life-changing or life-saving for people. We think it's just sort of everyday knowledge that we're sharing, but as you say, if it helps somebody go get that lump checked, or, you know, go follow up a symptom that they're having that could be life-threatening down the you know, later stage, it really is life-saving work. So we are just so incredibly lucky to have you as a grant recipient and be able to support the work that you do. And many of the things that you have mentioned there actually have related to some of our previous grant recipients in this health space as well. And in particular, just ensuring that that knowledge and understanding gets out to every woman and child and family, and how important that knowledge is. You know, we actually, I think one of our previous lunchtime sessions was around reusable menstrual products for women in other countries, and how, you know, the impacts that had, not just from a health perspective, but also an education perspective and an employment perspective. Because, you know, as Grace is saying, you know, these symptoms, they infiltrate all parts of our world, you know, our work, our family life, our community life. So it's so interconnected. So really wonderful to hear some of those stories of, you know, the impact of the work that you're having there, and hopefully making it a little less taboo for different communities to have these conversations. And I really love the idea of getting men in the room to learn about women's health as well, just so the men in our lives know about it too. You know, we want to raise our girls, but we also want to raise our boys to be just as aware of men's and women's health, and for it to be not taboo for us. I find it funny how, you know, girls and boys health is taught separately in schools, and then nobody learns about each other still. I find that quite, you know, incredible. So yes, there's still a lot of work to be done in this space. And Grace, your work in leading this work, in getting the conversation to be had in the workplace is incredible. I found it really interesting to hear how the UK have, you know, had these conversations and started to normalize this conversation, which is really great to hear. And it just shows you that it doesn't, you know, it can be done. We can have these conversations, and it hopefully will help, you know, each other, our workplaces, to be able to have a better understanding, and therefore better outcomes for all of us in the end.